A new health alert for children in New York City. On Tuesday, Mayor Bill de Blasio said 15 children between the ages of 2 and 15 were showing symptoms of the serious inflammatory disorder, Kawasaki disease. 4 of the patients tested positive for COVID-19, and 6 others had antibodies for the virus. Kawasaki is a treatable vascular illness that affects arteries that supply blood to the heart. Dr. James Schneider is the director of pediatric critical care at Cohen Children's Medical Center in Queens. He says there could be a link between the Kawasaki-like symptoms and the coronavirus. Dr. Schneider joins me now. Doc, welcome to Chasing News. How are you?
Good, thank you. How are you?
So, first of all, explain the disease itself, Kawasaki disease. Is it life-threatening? What should parents be concerned about?
Kawasaki disease is a very common pediatric diagnosis, and it is an inflammatory disease of the blood vessels, as described, and it presents with very common symptoms, which include a prolonged fever for about 5 days or longer, some rash over the body, swelling of the hands and feet, a red tongue, as well as red eyes. The most concerning consequence of Kawasaki disease is that the blood vessels of the heart or the coronary arteries can also be affected, and they could lead to aneurysms or ballooning of those arteries, which can lead to significant cardiovascular disease.
Is it genetic? Is it a virus? How do kids get it?
We know that it is likely associated with a previous exposure to either a virus or other environmental antigens. We just haven't really pinpointed it, but it's generally considered a post-inflammatory response.
Is this something that every flu season with the virus going around, the kids that have that, it triggers it, or do you think there's something separate with COVID?
We normally see a seasonal variation with Kawasaki disease, where this time of year, at least in the Northeast, we start to see more of it. However, we're seeing more than we would otherwise expect right now, and many of them are presenting with having a coronavirus infection as well. But we're also seeing kids who are presenting with an atypical form of this, which is presenting with a much more severe form, a shock kind of state where patients are much more critically ill, their hearts are being affected, their kidneys are being affected, and they require intensive care.
Okay, Doc, thank you. Appreciate your time.
You're welcome.